afternoon, everyone. My name is Emily Pearson, and I'm the founder and managing director at Our Minds Work. I'm joined by Emma Carhart today, who is my colleague, and we're here to take you through our webinar. This is going to be as interactive as we possibly can, but we do have a lot to get through in just an hour, because as we know, creating a mentally healthy workplace that thrives requires a little bit more of a strategic approach than just mental health awareness. So hopefully that's why you're here today, to get the most out of the session. So this session is how to maximize your wellbeing investment, ultimately for a winning business strategy. And the reason why we connected to a winning business strategy is that we need workplaces that thrive for a winning business strategy. So what we're going to be covering today in just 4 sections, the objectives are, first of all, we're going to take you through a best practice framework, which is ideal for driving culture change. And this is where we're looking at culture change to improve the wellbeing culture within your workplace. We're going to be looking at a strategy to proactively prevent work-related stress, anxiety, and depression. We're then going to go into your managers and how to equip your managers to foster mentally healthy team dynamics using some enhanced communication skills, which I hope you find really interesting. And then finally, we'll be looking at the effective ways to safeguard and maximize your investment in mental health first aid style initiatives. Style initiatives means mental health first aid, mental health advocates, mental health champions, manbassadors, menopause champions, ED&I champions, anyone that you have in the workplace who are potentially speaking to people who may be experiencing poor mental health and even potentially at risk of significant harm to themselves or others. So we will be covering these 4 areas today. Feel free to pop any comments in the chat box. We like to see you talking to us. We will have some time to go through any questions at the end, hopefully. But let's get started. Our overall outcome at Our Minds Work is to help workplaces to create mentally healthy cultures that can thrive. And that ultimately relies on human thriving. Without human thriving, we don't have a winning business strategy. So if we think about what do we need for a winning business strategy that relies on human thriving, it means that we're able to elevate productivity, retention, and your talent attraction as well, especially in this current climate. Employees want to work for employers who feel like they actually care about the well-being and needs, and they're not just a number making money for a company or for other people. They want to feel as if it has meaning in the work that they do as well. This can help us to mitigate the costs of absenteeism and presenteeism related to poor mental health and well-being as well. So there is a bottom line cost and return on investment to this. It can shield against work-related stress, anxiety, and depression, which we're going to talk about later. And it is a legal obligation for employers to do that. We need to cultivate a psychologically safe workplace, not just for employees to work more effectively, but also to create a place where disclosure of poor mental health can happen without the fear of stigma and discrimination. We also need to foster trust within a workplace culture that can enhance engagement. As you probably already know and have experienced many times in your lives, your manager is the person who you speak to probably the most within your organization. That team culture is really about your manager creating that culture for that level of engagement or complete disengagement if it's not done effectively. We know that human thriving, we need to ensure early intervention, support and recovery for people when they're struggling. And it helps us to establish a culture of care for a thriving work environment. You know, all of this stuff is pretty big. It is a big task to improve mental health and well-being in your workplace. So hopefully today, the 4 topics that we can cover will help you. Straight away in the chat box, what we'd like to do is know a little bit more about you. You know, why are you actually here today? Feel free just to put some comments in the chat box. What specifically do you want to get out of today? We're covering 4 topics. Is there anything that you particularly interested in? Maybe it's the mental health first aid information that we're going to provide today, because you've already got 50 mental health first aiders that you're not quite sure if you're doing the right thing to support them. But do pop it in the chat box. Let us know why you are actually here today. The first reason why we're actually here today is to give you some information on which best practice framework is ideal for driving culture change. And we receive lots of questions around this. This area of workplace mental health and wellbeing isn't regulated. There is some guidance out there, like the Thriving at Work standards, but nobody has really provided a best practice framework to create that culture change. So what we're here today to tell you a little bit about is how we do this with our workplaces. And hopefully it's something you can take forward for your strategy as well. We actually use a socio-ecological model. So this was created by Bronfenbrenner back in the 60s or 70s. This is a model that health and social care have used for decades and decades. My background's health and social care, over 20 years working in the field. And that's where I first ever learned about the Bronfenbrenner socio-ecological model. And what this model does, it gives us a framework which can show us how an individual is impacted by an individual as themselves, from their family, the wider organization, the community and societal factors that all influence a person's mental health and well-being, either positively or negatively. So these can be risk factors, or they can be really positive protective factors. This model that we use it's used by the CDC, World Health Organization, and Public Health England as well. So what we've done is we've turned it into a really kind of simplified approach to use as a framework, not just for improving mental health and culture change in the workplace, but the model works for anything. This could be a strategy for suicide prevention. It could be a strategy for changing the culture around menopause. It could be a strategy to change the culture around men's mental health and well-being. So let's get into it. This is the model in itself. So this is the raw Bronfenbrenner model. And as you can see, we've got these areas or ecosystems that surround an individual in the middle that will either be risk factors or protective factors for that person's mental health and well-being. Obviously, the closer to the individual, that is the closeness of what's actually happening to that individual. And right on the outside, we've got the policy, and that is obviously something that is much more kind of removed, but has a big impact on that individual's mental health and well-being. So we always start in the middle with the individual. So again, think about these could be risk factors or protective factors. What we use this model for is to build protective factors, but understand the risk factors as well. So if you think about all the individuals in your workplace, they will all be very, very different. Their age will be different, their sex and gender, their genetics, their health, their knowledge around mental health and well-being, even their culture and beliefs around what mental health means to them, any past trauma, and even life events that are currently happening are either risk factors or protective factors for that individual's mental health and well-being. Interpersonal, these are our social supports and family impacts. Now, again, these can either be a protective factor where we've got great social supports, great family impacts, or really negative ones, lack of social supports and loneliness, a lack of understanding and support from our families. We then have the organisation. So this is why you're here today, from your organisational perspective. And the culture in your organisation can either impact negatively or positively somebody's mental health and well-being. And as you can see, it's much more than just that skill of a manager or the quality of the work. There are some significant impacting factors, like we can see here in trust, the interventions that you already have in place, and the relationships between your teams, it can be quite complex within itself as an organization, and what your current strategy looks like to improve mental health and well-being. We then have our societal impact and factors. So, what is going on in that individual society, in the communities that they live in their home life stresses, like financial stresses, relationship breakdowns and problems. Do they have access to the right services that are there available for them? What are the social norms within their community? Maybe it's high use of drugs and alcohol. Maybe the social norms is that we don't talk about this stuff, and those cultural impacts that can be either positive or negative as well. And the final one there is policy. So obviously government has government policies around health and well-being. We have a government policy around suicide prevention. But then within your organization, you do have policies that you are also responsible for, like employment law, health and safety legislation, and any other internal policies and procedures as well that may either help and support somebody or negatively impact them. I do recommend that you go and do a little bit more research on this, because it's really, really interesting to understand. But what we've done is we've really tried to simplify it for you to give you a best practice framework for culture change. I am going to send this over to you as a resource after today in a follow-up email. So I am just going to share this. So what you'll see is we've created we've redeveloped that framework into a very easily benchmarkable model for you to use. So we can see here at the top, we've got at risk, box ticked, mentally healthy, and inspiring culture. Obviously, as you can see there, the more we do to reach that culture change, the more positive impacts, the higher the return on investment on average. When we go down the side, we can now start to see what we need to do to support those individuals. So when it comes to senior leadership and sponsorship, none of this will happen without buy-in, without genuineness, authentic buy-in from your senior leadership team that improving mental health and well-being and culture is the right thing to do. What treatments and therapies do you have in place, and how are they utilised? Are they used as prevention or more of a kind of reaction? What about your strategy and your policies that are there to either promote mental health and well-being and support employee well-being, or to make sure that we're legally compliant in the workplace? Do you feel as if they're effective, you've got the right levels of support, and you are legally compliant when it comes to mental health? The next section is the management and prevention of work-related stress. So this is very much around the preventative side of the impacts of work-related stress, and we are going to do a deeper dive into that a little bit later on. When it comes to your managers, they are your culture creators, and we're going to do a deeper dive into your manager training as well. So what we look at with regards to your managers are your managers creating toxic stressful workplaces that people want to leave, or are they actually creating subcultures within their teams where people want to stay, they're productive, they're impactful, and they're supported to stay mentally healthy? We then have your peer-to-peer support, which is built into this model, and we've put mental health first aid style initiatives in here just to make it really, really simple to understand. But what we also know, and we will take a deeper dive into this a little bit later, that with the rise of menopause champions, ED&I champions, men's health champions, anyone that is being put into a role there to support other employees, we have seen the same problems that leave potential risks to you as an organisation, but also to staff as well, when people are not being safeguarded. So we are going to look in a little bit deeper into that later. Employee awareness, what do your employees need to know about mental health to help them to be empowered, to know how they can look after their own mental health and well-being, but what support is available if they do need it. And of course, how you're monitoring and embedding everything. So what is your data telling you? You know, these are the basics, but then to go a little bit deeper, what is our data telling us through employee surveys? Where are the pain points and the problems that we need to tackle to improve mental health and well-being within our organization? So this is the model that we're really going to support with. So if you think about the Bronfen-Brennan model that I've just gone through there, your employees, your individual in the middle, yeah, think about all of their individual needs that they may be bringing to the table. Your peer support is your social impacts. Yeah, this is about the social impacts in your workplace. Who are the people who are there who can support your employees if they are struggling and do need listening and signposting services? With regards to your managers, this is part of your organizational approach. So within the organization, your managers are either extremely positive impacts on employee mental health and well-being, or the complete opposite and can be risk factors to mental health and well-being. So they play a big part in that. The management and prevention of work-related stress is a legal requirement for you as an organisation as well. So we're still in that organisational part of the Bronfen-Brennan model. And the same as your strategies and policies as well, internally for you. And obviously your governmental ones like your Equality Act and your HSE management standards are all part of that bigger circle in the Bronfen-Brennan model. Obviously, treatments and therapies are really important that we make sure that people get the right support when they need it. And none of this happens without senior leadership and sponsorship as well. Just to finish this model off, so I can take you through a little bit of a journey with it. As you see, we've just gone through it in terms of mental health, but you can use this exact same framework for any kind of well-being culture change, because that's exactly what it was developed for. It was developed for behavior change. When we look at what we want to achieve within the mental health section, you know, we want to be getting into the mentally healthy and inspiring culture sections, but we can actually look at these levels for any of the topics. So let's take, I don't know, menopause, huge at the moment, quite rightly so, 45-year-old woman sat here. Senior leadership and sponsors have been really, really instrumental in really pushing this trend forward to make sure that the commitment and time is genuine and it's given what it needs to invest further in providing support for women who are struggling with menopause within an organisation. Treatments and therapies, what do you have in place? Maybe it's your EAP or Occy Health are there that have specialist support for women who are struggling with menopausal symptoms. A lot of companies created a policy and a strategy based around menopause in the workplace as well, and what you were going to commit to as an organisation to support women when they needed it. Obviously, the management and prevention of work-related stress, you know, we know that stress in the workplace can worsen symptoms of mental health, poor mental health, including menopause as well. We then have your managers. What do your managers need to know about menopause and how to support their colleagues? We now have lots of menopause champions. So there you've got a peer-to-peer support network in place. And ultimately, what did your employees need to know about menopause? You may have, you know, developed some menopause awareness sessions for employees as well. So as you can see, we can use this framework for any well-being topic, and, you know, take it away. We'll send it to you. And I really do hope that section 1 has been quite useful so far. So I just want to summarize that we've literally just started off with a framework for behavior culture change that is used in public health and has been used for decades and decades. We've redeveloped this and brought it into the workplace to create a very, very simplified framework that you can build your mental health and well-being strategy around, to make sure that you're utilizing the layered approach and you're taking a whole organizational approach from senior leadership and buy-in, sponsorship, all the way down to what your employees need with prevention, early intervention, treatments and therapies as well. So Section 2 is, okay, one of those sections was around work-related stress, and it had its own section around there, because ultimately this is around prevention. So why do we actually need a strategy to proactively prevent work-related stress, anxiety, and depression? Well, let's find out what you know about this. We do have a little bit of a poll. It has 7 questions, so you should see it just pop up on your screen. Sorry if you don't see it. It's usually something to do with how you've maybe logged in on your browser. However, please do complete the 7 questions. So question 1, what is the highest reported cause of work-related stress, anxiety, and depression? Every year, the HSE collect this data, and they tell us every year, and the highest reported cause has been the same since 2009. Question number 2, what % of suicides are estimated to be caused by work? Question number 3, chronic stress can also cause. There's quite a few multiple choice answers there. Question number 4, is it a legal requirement to prevent work-related stress? You should know that because I have mentioned it a couple of times already. Question number 5, what % of sickness absence is due to work-related stress, anxiety, and depression? Number 6, who reports the highest levels of work-related stress? And number 7, what occupation reported the highest levels of burnout in 2022 and 2023? So some questions there just for a little bit of fun, but just get you to think about work-related stress and the impacts that it can actually have on employee well-being in your workplace. I'll just give everyone a few more moments to go through because there is quite a few questions there. It looks like question number 1, you're doing quite well, done quite well on that so far. Oh, question number 2. Oh, we've just got 1 right answer on there so far, so that's going to be interesting. Just a few more moments for the last 2 people to complete that. Great. Yeah. Oh, nearly everybody's got question number 3 right. Wonderful. Okay, let's have a little look. So let's go through some of the answers. So question number 1, what was the highest reported cause of work-related stress? For those of you who said high job demands, you were completely correct. And this has been the case for a very, very long time now. Work-related stress, anxiety, and depression is at the highest it's ever been since data began in the 1980s. High job demands have always been at the top, but also closely followed by a lack of manager support. And if we think about stress, you know, the demands that are put onto us, if we don't have some support from our managers around that, that means that we're unable to be more resilient around those demands that are being placed upon us. Interesting, what % of suicides are estimated to be caused by work? Well done to the 1 person that said 10%. This was estimated about 2 years ago now by Hazards Magazine, which are a health and safety organisation. And there is plenty of evidence out there now to show us that, unfortunately, suicides are being caused by the work that we do in the UK around work-related stress. Chronic stress can also cause, well done to everyone that said all of the above. Work-related stress is absolutely horrendous for our physical bodies, our mental health, even down to our sex life and temporary infertility. So one of the reasons why it is a legal requirement to prevent work-related stress. So well done to everybody that got that right. What % of sickness absence is due to work-related stress and anxiety and depression? So well done to the 80% who said 51%. That was absolutely correct. And who reports the highest levels of work-related stress? Well done to the 60% who said females. And what occupation reported the highest levels of burnout? This may be a surprise. It was HR professionals. So well done to the 60% that said HR. So We know it's important. We know it has a huge impact on mental health and well-being. We know that it's a legal requirement, but how well are you doing within this section? We've got two separate legislations to be aware of. We've obviously got the Health and Safety at Work Act 74. This gives you the duty of care as an employer to ensure the health, safety and welfare at work of all of its employees. And if we drill down into that, we can go to the Management of Health and Safety Regs 99. So yeah, this isn't new. It's been around for a very long time. And this is what gives employers, this is leadership and managers, the legal duty to protect employees from stress at work by doing a risk assessment and acting on it. The HSE management standards approach really helps us to figure out, what are the primary sources of stress at work? Because these are the areas that we need to effectively manage if we want to prevent and reduce work-related stress that can lead to all of those problems that you've just looked at in one of those quiz questions. The management standards cover demands, control, support, relationships, role, and change. So as you quite rightly said, demands, that workload, work patterns, and the work environment is and has been for a very long time the highest reported cause of work-related stress, anxiety, and depression. Closely followed by support. So that's a lack of line management support and encouragement, but they can, within the management standards, include colleague support as well. We also find that relationships as well play a big impact. I think this is the third one, especially where conflict and unacceptable behaviour isn't being dealt with. Things like bullying, harassment can cause really high levels of stress. So there are ways to do this. There is stress risk assessments, there is guidance, there is a legal obligation, but where are you? So let's go back to our framework again. Our at-risk, box ticking, mentally healthy or inspiring culture. And here we go, we've got the management and prevention of work-related stress, all just laid out underneath there. This is an opportunity just for you to do a little quick benchmarking of where you think you are as an organisation right now. Are you in the red? Are you at risk? Are you not conducting stress risk assessments? This means you're not legally meeting legislation, but as you can see, there are some significant impacts for you as an organisation. This means that you're going to have higher turnover, sickness, absence, potentially high levels of accidents and human errors if staff are potentially stressed and at burnout. Could lead to litigation, poor reputation, psychologically unsafe. Nobody wants to work here. Is this the area that you're in? Hopefully not. Hopefully we've got way beyond there now. You may be just in the box ticked area. Are stress risk assessments being done? But they're maybe being done by Occupational Health or HR, and it's usually as a reaction to somebody going off sick due to stress and mental ill health caused by work-related stress. You are still not meeting HSE legislation, and that is often reactive rather than preventative. So to get in the mentally healthy section, we need to be completing preventative stress risk assessments, stress risk auditing being done, action plans being implemented, training for managers to be able to identify work-related stress, know the management standards and how to create stress-free teams where possible, and be able to do stress risk assessments on a regular basis to manage that. Up into the inspiring culture, this goes much, much deeper. This is looking at job roles. Are they being designed to create good work for people rather than stressful work? Obviously, the managers are a really, really important part of whether they're creating stressful working environments or not. Your preventative stress risk assessments are absolutely important at this point. But we should be conducting regular department risk assessments and audited on a regular basis and constantly benchmarking. So where do you think you're at? You know, if you feel free to pop in the chat box if you want to. If not, it's probably worth having a little think about, okay, well, if we're here, we are box ticking, what do we need to do to get into that yellow section? What we should be achieving for is always the mentally healthy and inspiring culture, because this is about making sure you're legally protected, but that you're also engaging in your best practice standards as well. So just to summarize that section before we move on, that section was specifically around work-related stress. As we know, work-related stress can create mental health problems. It can trigger suicide. It can trigger heart disease. It can trigger burnout. You know, if work-related stress was a chemical in a workplace, we would be taking this much more seriously when it comes to health and safety. For some reason, we're just not quite there yet. So benchmark where you are using the progression model so that you can work out, okay, where we are now, what do we need to do to get there to make sure that we're legally compliant and we're able to create mentally healthy workplaces where stress prevention is a part of your strategy. Okay, we're zipping through this today, which is good because we've got a lot more to cover for the next half an hour. So the next section is about how to equip your managers to foster mentally healthy team dynamics. And there's a few reasons that are pretty important why we actually do this. So your managers are literally your frontline culture creators. You can have the most amazing behavior strategy piece that have been worked on for a long time by your leaders and directors of what you want the culture of behaviors to be created for your organization. But ultimately, each manager creates its own subculture within the organization. And what we know what happens, unfortunately, when there are poor management implications in teams. But what we want to focus on really is, what is it the best practice? What do we want to get out of this? What we want to create is empathic managers who know how to prevent stress in their teams because they're understanding of what their team's limits are and where they're at the moment. We want them to be connected because connected managers can recognize when someone's struggling because they know their teams really well. They know what's their normal and when people are moving out of that normal. We want them to be confident because confident managers know how to support colleagues who are going through a difficult time. You know, you can only control a certain amount of impacting factors within your organization. But as we know, life happens. We don't just leave it at the door, we bring it to work. And ultimately, what we're asking people to do is to come forward and ask for support, and our managers will be here to help you. But what if we haven't provided them with the training and skills and knowledge to do that effectively? We need to empower managers with the knowledge, the skills, the tools to be able to problem solve how they support their team members, not just around mental health and well-being, but just in general. We also need skilled managers because skilled managers are effective communicators, and we're going to go into communication in an enhanced style in a few moments. Ultimately, we want our managers to inspire. We want them to inspire our teams and celebrate achievements because we know that this is great for productivity, but it's also great for our employees and their well-being as well. Ultimately, great managers motivate employees to stay, and that's what we want. You know, we're putting all of this work and strategies and creating this team and organization where ultimately we want to keep the best talent. We don't want them leaving. So here's a question for you. Are your managers creating cultures in their teams by default? Do you just recruit them? They come along and there's no kind of strategic design around how your managers are given this knowledge, skills, and tools to create mentally healthy teams? Default, or are you doing it by design? So let's find out. I do have a little bit of a poll for you again. So this is the second one. 3 questions on this one. It's just launched there. Number 1, do you recognize the parent-child dynamic in your team cultures? Question number 2, how is culture created by your managers? Question number 3, what development have your managers been provided to improve mental health and well-being at work? We are going to go into what the parent-child dynamic is, but you may have already recognized this without us even going into it, or you may already know a little bit about transactional analysis. And you may see this a lot. I know we hear it all of the time. We get into that parent-child dynamic within teams. The manager comes across as the parent, and this can be quite stressful for managers as well, when they're taking on too much around other employees' well-being. Just a few more moments to complete this, and I will share the questions in a moment. Okay. Share the results. So obviously 40% already knew what we meant by the parent-child dynamic. So this will definitely be interesting for you to hear. One person said, no, that's great, but what dynamic do you get? Are you getting the adult to adult dynamic? Maybe if you're not sure, hopefully you're going to learn a little bit more about what we mean in a moment. So how is culture created by your managers? 20% said we rely on naturally good managers to create those cultures. 60% said we have no effective or consistent training in place. And just 20% said we have an effective and consistent developmental course for managers. We hear this all of the time, so this isn't unusual for us to see. And the last one, what development have your managers been provided to improve mental health? The 60% have received general kind of short education, mental health awareness. 40% have had mental health first aid. Nobody's doing management apprenticeships, but 60% have had another leadership development course. So it sounds like we've started something. There's something going on there around manager development that you're already thinking about. We look at manager training through a set of enhanced manager skills that go way beyond just mental health awareness. And as you probably see already, when it comes to creating a culture, it takes a lot more than just knowing the signs and symptoms of stress, anxiety, and depression. Your managers are there to create the culture. And what we found over delivering manager training around mental health in workplaces for the past 8 years, these are the most impactful enhanced skills for managers that they can have just for creating a culture, but also for supporting employee well-being. Being able to lead with empathy, having confident active listening skills, having non-judgmental listening skills, and also understanding the theory and the model of transactional analysis so that they can put it into place within their teams. And that's what Emma's going to take us through next. So I'm just going to hand over to Emma at this point.
Thanks, Emily. Thank you. And it's very much following along with the vein of the journey that you took everybody on this afternoon. And you very quite rightly highlighted the importance of having managers with these heightened skills to be able to be these culture change, instigators, because they are frontline with our employees, and their interactions with these employees are extremely important in terms of how they communicate and how they communicate and change this culture. So TA, and I'm going to talk a little bit about transactional analysis, TA, as we call it. This will be a very light touch on TA. People study for years around this topic. They get master's degrees in this. However, it is a topic that we do cover in our manager training. We do cover it in our level 5 and level 4 training as well, because it's an integral part. It's a skill set that somebody can develop, which will have massive impact on how they interact with their team members. So I'm just going to tell you a little bit about TA first before we look at some examples and how it impacts in the workplace. So TA was created by a psychotherapist back in the 50s called Eric Byrne, and he created this as a way that we understand how we communicate with other people and how people respond to us and why they respond in that way, which is very, very insightful when you do a deep dive on it. But they talk about the kind of underpinning behind this is that we all come from, when we communicate with people, from one of these 3 ego states. Either come from an ego state as a parent, an ego state as an adult, or an ego state as a child. And these different ego states and how we communicate from those depend on our experiences, and they really kind of influence our thoughts, our behaviors, our feelings, and cause us to react, transact differently with people around us. So as Emily talked about that parent-child dynamic in the workplace before, we kind of put that into the workplace, and we try to understand, and recognize, first of all, that this is happening, and understand the implications if that's actually happening, and then try to move towards a more efficient, a more supportive way of transacting, a way of interacting with our team members. So that's the kind of background between us and TA in the workplace. If we move us on, Emily, a little bit more around kind of the benefits of it and why it works, and the background to it. TA helps us to change our attitudes and beliefs about people. So at the core of this culture change is our line managers, and it's about how they interact and how they see their team members, their colleagues, and so on. And the kind of underpinning beliefs around this is people are okay. I think sometimes in a workplace, managers maybe forget to see their team members as people. It's about how many of you produced this week. It's about how much have you brought in this week. And the kind of, it gets very kind of transactional, whereas we're looking at this as a person and how this person then responds. As Emily talked about the Bronfenbrenner social economic model before, these people have lives outside of work. So it's about bringing that back to the awareness and seeing them as a human being. Communication is free and open, and it does promote direct and respectful communication, which again we know will kind of fuel productivity, relationships, and a mentally healthy culture. Every human has the ability to think. And going back to that child-parent dynamic, if you think about what parents do, obviously sometimes they take all the choices away from the child, they tell them what they should be doing, they act as the one that's in charge all the time, when actually we know from manager theory and models and so on, we need to empower our employees. So looking at how they communicate with them can be a really integral part of that. And decision and solution focus, it helps you to learn from past decisions and make smarter decisions in the future, rather than relying on the go-to line manager to tell me what to do. We want to empower our employees. We want to create this mentally healthy culture. So as Emily talked about before, have you noticed a parent-child dynamic in your teams? And I want to just take you through a few examples which will kind of hammer home what we mean around that. So first of all, just having a look at these ego states we talked about. So all of us, everybody here comes from, at some point in time in the day, in the week, these ego states. So the parent ego state is copied from the parents in our childhood or caregivers in our childhood, what we experience, how those people influenced us, how they reacted with us. And some of us have a controlling parent experience where they told us what to do all the time and sit down and don't talk and do this and do that and be finished by this time. And others had nurturing parents where very caring, I'll take care of that, let me do that for you. And some of us had a mixture, but those can influence how we then interact from a parent ego state, and things can trigger us to communicate from that state. The adult ego state, that's the very much here and now. That's responding to what's happening, that's looking at all the information, very rational way of thinking, problem solving in the moment, not influenced by emotions, not influenced by the past or feelings, it's here and now. And ultimately, as you'll see, that's what we want managers, employees to communicate from in the workplace. It will get stuff done. It gets stuff done when we communicate from that kind of ego state. The child ego state, this is an interesting one. Again, that's influenced by our own experiences as children, what we preserved and we played from our childhoods. And actually, as you can see on the right-hand side, that could actually be an adapted, compliant child. So yes, I'll just do what I'm told. I'll make everybody happy, whatever, I'll do everything to be compliant. Or a rebellious child. I was one of those, unfortunately, who goes, as soon as they're told to do something, they go, no, I don't want to do that, which kind of indicates why the people respond in certain ways when they have that manager who's communicating from a parent ego state, particularly controlling, which is very interesting. So you get that dynamic where somebody's saying, do this, do that by 7 o'clock, and the person's saying, no, I don't want to, why do I have to do that? It's getting on my nerves, I don't want to do that. So I just want to take you through a few examples, Emily, in the next slides, about we've got something called cross transactions and something called complementary transactions. So I'm going to look at a cross transaction here. A cross transaction is where we come from different ego states that clash. So they don't necessarily flow in the communication. So I'm focusing on communication around, and possibly in a workplace, around between a manager and employee, mental health, well-being, and so on. So, for example, the example we've got here is the employees coming from, I can't do this. Why is it always me that gets the extra work that stresses me out, from the employee perspective? Now, if you do a deep dive in terms of understanding the ego states, you'll understand that this is very much coming from a child ego state. So they're coming from a child ego state, and the language there is that's always, never. If you think about how 4 and 5-year-olds talk about it, it's no, never, oh, fair, it's always me that has to do this. So it's coming from that perspective. So this something has triggered this individual to talk from that perspective. It's not fair. And then we've got the response from the manager. Oh dear, that sounds terrible. Let me see what I can do to make it easier for you. So if anybody's thinking, yes, parent ego state here they're coming from, this is a nurturing parent ego state. So they're responding back to that child. However, it's not getting stuff done, is it? It's not going to get stuff done, because what I want you to think about for all these examples is, what is the impact potentially in the work setting on the employee's accountability? So how accountable will they feel if that's the response from the manager the next time they go to ask them something and the manager says, don't worry about it, I'll do it, I'll make it easier for you, let me help, let me support. How is it going to impact on their trust and the relationship generally, within a work setting? How is it going to impact on all those things? So cast your mind back and think about potential workplaces, maybe where you've worked, maybe think about your own management style, what you've seen as well. Let's have a look at another example here. So I've got a different example here. It's the same conversation we're having around well-being and mental health. So the employee this time says, I'm feeling stressed. I can't cope with this extra work. So the employee is coming from, remember, the adult ego state was about the here and now. There's not a lot of emotion in there. There's not a lot of kind of tantrum given. The language we talk about, always, never. It's very kind of straightforward. It's very transactional, isn't it? It's very there. And then the response from the manager is, well, we need to reach these targets. So what we identify in here is the response is coming from the manager's parent ego state. But this time it's a bit like that. Rather than cuddling them, it's a bit like, you need to do this and do it quickly and do it by 5 o'clock. So again, my same question there is, what's the impact if you have a workplace where that's the constant style of communication? The employee is coming from it, trying to come from an adult ego state, but the manager is coming back with it, well, get it done. What's the impact on the employee's trust, accountability, motivation to actually get the work done, and the state of the relationship between those two? And finally, I just want to have a look at this last one. This is where we want to aim for. And this is what we talked about in our training with our line managers. We want to kind of move towards adult to adult conversations. It's the here and now, it's the rational part. It helps us to get things done. It's productive. It increases trust, it increases productivity, it increases accountability. So here we say the employee saying, I'm finding this difficult. Again, they're coming from the adult ego state. There's no emotion there. There's no tantrums. It's just literally stating this is what's happening. The response from the manager is, okay, let's talk about it. Let's look and see what we can do. Let's look at our options. So that's what we call a complementary transaction, adult to adult ego states. And now what I've tried to kind of hint about is, deep diving and understanding this as a manager is, what is my impact from communicating with this ego state on my employees' motivation? How motivated will it be to do work? Productivity? How much they get done? Accountability, how accountable am I as an employee for my work and for my responsibilities? If I go to my manager and they respond from a parent ego state, nurturing, taking everything off me. and trust. So, you know, in summary, the line manager, as Emily has said several times today, they are the culture change creators. They're at the heart of what we're trying to do within an organisation around mental health, mentally healthy communities and workplaces. If you invest in the skills training on this, it's something that will absolutely help your teams to thrive in terms of changing that culture around mental health within the work setting.
Thanks, Emma. Thank you. So you can see how much we've covered today, and we've got literally a couple more minutes just to cover the last section of this. This is the effective ways to safeguard and maximise your investment in mental health first aid or mental health first aid style initiatives. And there's two things really that I want to cover with you today. I'm not going to do the poll just for time's sake. I want to get through how to safeguard your mental health first aid style initiatives first. What we have found over the decades of working in health and social care is safeguarding people has to be a #1 priority. When this doesn't happen, things go wrong. And when things go wrong, it's certainly not pretty, and it's not anything that anybody wants to have on their conscience. So when we're looking at workplace mental health first aid style initiatives, these could be advocates, champions, you know, all the things that I've said to you today. What has happened quite often is that people will go, oh, that's interesting, that's me, I want to be a mental health first aider, an advocate, champion. And people put their hands up and they will be sent on a 2-day training course. Often that is it. They're then waved off back into the workplace to be your mental health first aider and do your mental health first aid champion role with very little governance, compliance, safeguarding, monitoring, ongoing support. So I'm just going to really give you some highlights of things to consider if you do have any kind of initiatives like this. The first thing I want you to think about is how are you recruiting people into these roles? Like I said, it's usually a hands up 2-day training. It's not enough. Yeah. We need to make sure that everyone in your organization is kept safe. And one of the probably potential risks that you may not even realize is there is what if your mental health first aiders are speaking to vulnerable people? So these may be people with mental health disabilities, neurodiverse colleagues. These may even be school leaver apprentices. These are people in a workplace who we have to protect their health and well-being due to potential vulnerabilities. So if we always look at what's the worst that could happen, there are potential hazards and risks just because of a lack of safer recruitment when it comes to your mental health first aid style initiatives. And I will send this infographic out to you. Once you've recruited, selected, then it's about making sure that you're giving them the right training for the role. So if you just want people to be able to respond in a mental health crisis, then mental health first aid training all day long. But if you want to really broaden out the role into more advocating for good mental health and well-being and promoting good mental health and well-being preventatively rather than reactively, you need a different training course. So think about the training. Mental health first aid isn't the only style of training. And if we look at this comparison here, what we can also see between a mental health first aid, which is very reactive and responsive, versus an advocate who's advocating for good mental health and well-being, they are much broader in what they actually do within their role. They're able to ensure that they are productive in their role, they're engaged, they campaign, they raise awareness, they share their own lived experiences safely. And what we also work within our Minds work is we have a blueprint to make sure that all of your governance and safeguarding is actually implemented as well. So what I'd like to think about, or get you to think about, is do you have a safeguarding policy and procedure for your whole organisation that is very, very clearly embedded into your mental health first aid style initiatives, where people know exactly how to respond in a crisis, how to where to report that crisis, and who's reviewing it and taking responsibility for it? Do you have clear governance and compliance set out for mental health first aid style initiatives, so that they know that if a colleague comes to speak to them about a drug and alcohol problem, they may be coming to work under the influence, they may be a victim of domestic violence, you know, way beyond mental health first aid. Humans have lives outside of work. Do they know how to clearly respond in these situations and have your legal governance and compliance to follow that you are responsible for as an employer? Monitoring. How are you monitoring your mental health first aiders? How are you collecting data so that you're able to recognise how people are being supported, where they're being signposted to, what particular trends are being utilised by your mental health first aiders as well. But also collecting feedback from any colleagues who use your mental health first aid style initiatives to be able to ensure that your mental health first aiders are not moving outside of their boundaries. They're not giving advice. They're not talking about their own problems during these contacts and conversations. They're not, you know, arranging to meet a colleague for an hour every week, which then turns into, you know, unofficial counselling sessions. So as you can see, a lot of this is about risk-based and making sure that you're mitigating as many risks as possible when it comes to the implementation of your service. So you'll see all of this in this infographic here, which we go through when it comes to the monitoring and reviewing as well. So that's just some initial questions to get you to think about, how are you safeguarding, policy, compliance, governance, safe recruitment, the right training for people, and then also the ongoing monitoring and support that's required. Yeah, way beyond just put your hand up, mental health first training, and then we're away. The second one that I wanted to share with you is about maximising the investment. So when it comes to maximising your investment, just need to toggle across here.
Sorry, Emily, just to say, we're not seeing any infographics there. We're just seeing the slides still.
Oh, no, I've just gone through all of that and you couldn't see the infographic. You will receive this infographic. I am so sorry. I thought I had actually shared it. You will receive all of this. Sorry about that. When it comes to maximising, here we go. When it comes to maximising your service, I just want to quickly share with you a part of our blueprint when it comes to your colleague journey. What we often find is companies will come to us and say, we've got 200 mental health first aiders, they're not being utilised, they're not being used. And one of the things that we show them through our blueprint and support service is, this is usually where companies want to train the mental health first aiders and they want this to happen straight away. They're mental health first aiders, people are coming to them, they're talking to them. But as you can see, to get to this first engagement, there are a lot of actions that need to happen as touch points. Front stage actions and backstage actions to actually get to the point where it's being utilised. So if you're finding that this isn't being utilised, your mental health first aid investment isn't happening, there are many reasons and actions that need to be put forward to do that. So what I want you to think about when it comes to maximising this is, how do you actually look at, when it comes to speaking to your mental health first aiders, how are they promoted, how are they visible, and how are you building trust? These are the three most important things to engage, for first engagement to happen. People won't utilise a service that they don't trust in and isn't visible and isn't easily to access as well. So we have rambled on that long today. I told you we had a lot to cover. I just really want to just finish off with just a final slide on how we can help. I am going to send you up some resources that we've covered today, just to really help you to get thinking about, how do you embed this into your strategy going forward. I'm going to send over some information as well You know, if you found this really useful and interesting, we do provide a service where we become an extended part of your HR team. That means you have us as the mental health and wellbeing experts for every month as an extended part of your team to help you to support putting this into practice in the workplace. If you do need some more information about safeguarding and maximising your mental health first aid investment, I'm going to drop a link in the email so you can book in a free 30-minute consultation where I can actually benchmark where you are and what you need to get to as best practice so that you can really figure out how to safeguard and maximise that investment going forward. If you would like some more information about enhancing your HR manager skill, your HR and manager skills, I'll send over that information to you as well in the email, and all the other resources that we've covered today. Thank you so much for joining us. We hope you found it really, really useful. I think we could have probably put more time into this. Maybe run a session for a little bit longer than an hour, or maybe I shouldn't talk as much, one of the two. But you know, we will follow up with the recording and all of the resources from today, and a little link if you would like to take advantage of a free 30-minute consultation. I will look forward to receiving your invite and speaking to you soon. Have a great afternoon, everybody. Thank you for joining us.
Thank you.